The VPPRN, or the Vasculitis Patient-Powered Research Network, is exactly what it sounds like. It is an online research network of thousands of patients with vasculitis who are coming together to work with investigators to answer questions that are important to patients and important for us to understand vasculitis and how to treat it better. Patients participate by giving data about themselves. They do it online, and it can be done anywhere in the world. And we've been very successful in getting more than 4,000 patients with every type of vasculitis to participate, and we do research studies that are far-ranging from survey questions to clinical trials.
Anyone can join from anywhere in the world. All you need is internet access. In the beginning, you fill out some forms that tell us about your vasculitis symptoms, your doctors, your treatments, and then every 6 months we come back and ask you a few quick questions about how you're doing. And this way we can gather information from all the different forms of vasculitis all around the world so that we can do research to learn more about vasculitis and to find new treatments for vasculitis.
When patients give their data, what happens to it? How is it stored? And do you ask for things other than every 6 months?
Yes, we will ask you sometimes if you've had a flare, for example. You can also ask research questions through the registry. The data is very secure. We follow all the guidelines. The data is shared with investigators who are doing research. We have a process where the studies are reviewed, and we have patients participating at every level in the process for doing the research.
I will just comment that I've been working with patients in the clinic for decades, and for the past 15 or 20 years, increasingly embracing this idea of working with patients as colleagues in the research. And I will tell you, it has changed the kind of work that we do, much for the better. Having a patient who has a lived experience with vasculitis and has the experience of knowing what it means to have vasculitis really adds to how we do the research, not just how we fill out forms, but what questions we ask, how we do it. And that collaboration has really enhanced the research that we do. And it's something that is built into the Vasculitis Patient-Powered Research Network.
I think that's one of the biggest strengths we have in the VPPRN, that patients are at the table and actively participating in all aspects of the research. It keeps everybody focused on the goal, which is patient-driven research. It's easy. You can just go to the website and sign up. It takes a few minutes to fill out some questions. And then, as I said, we'll come back to you every 6 months and ask you to give us an update on how you're doing. Initially, it takes about 20 minutes, and then after that, every 6 months, about maybe 5 to 10 minutes to answer the questions.
And one of the things that's been great is we have, as we said, we have over 4,000 patients with every type of vasculitis is included. We now have enough patients with many of these different forms of vasculitis that we can study them individually, and sometimes we study them collectively as a group of patients with vasculitis. It's worked very nicely.
Yeah, in fact, even the most rare forms of vasculitis, we have over 100 patients of each form in the network. I think that's another strength of our network.
It's very efficient, and there's a cost. Research costs a lot of money to do. The traditional way of doing research is you come to our medical center, we do things, and that's still very valuable. But the research we do through the VPPRN uses a different resource, which is the network and our patients, and that can be very efficient. So we just recently completed a study that involved over 1,000 patients, and being able to get data back from 1,000 patients all over the world who don't have to live near a major medical center costs just as much to do that as if we had studied one patient. So it's really a remarkably different approach that has been very successful.
Let's talk about some of our current studies in the VPPRN.
Some of our more recent studies that we just wrapped up, one was about skin vasculitis, for example. That affects many different types of vasculitis. Another recent study is called PANDA. PANDA is a study where we're looking to predict who gets vasculitis before they ever get it. We're using a very large amount of data from millions of patients, and we're partnering with patients to ask questions using something called machine learning and fancy statistics to come up with predictive rules that could tell a physician or a patient earlier in their health journey that they might be at risk for vasculitis, and maybe that should be looked at.
I know many of us living with vasculitis experience great delays in diagnosis. We'd love to see that shortened for the future.
Another recent project we just wrapped up was VasSleep, which is about sleep, We all sleep, or we all want to sleep, and our patients have often told us about problems they had with sleeping, whether it's due to the medications or concerns, or because every human has different patterns of sleep. We worked with patients and professionals who study sleep, and we did a big survey. We had over 1,000 patients participate with different forms of vasculitis. Those data are now being analyzed now, but we're going to get a unique look at something that's important to everybody. And this was a question that actually came from patients. They said, we're having sleep problems. Why is no one studying it? Well, you know what? Now we have. So we've talked about why the VPPRN is so important and has been so successful in advancing research and why you should be part of it. Come join us in the VPPRN and help us make vasculitis research even stronger.